Doctor, I feel like I have a blocked pipe down there. Can we do it like the plumber did? Insert a probe, unclog everything, and I'll be back to functioning like I did in my 20s? This is the phrase I hear almost every day in my office. And every time, I have to give the patient news that leaves them speechless. The brutal truth is, your penis is not a sink. And trying to unclog it the wrong way is not only futile, it could be the beginning of the end for your sex life. Today, I'll explain exactly what happens when blood stops flowing where it needs to, why clogged arteries are actually a deadly warning your body is sending you, and most importantly, I'll reveal the only truly scientific method to reopen those arteries, without falling for the trap of miraculous promises. Stay with me, because what we're about to see will change the way you look at your body. I am the Dr. Melissa Russo, urologist. For 15 years, I've been working in the trenches, seeing thousands of men who, just like you, are seeking serious answers in a sea of misinformation. My job isn't to judge, it's to solve. But before I get into the anatomy and reveal how to save your erection, I have to ask you something quick. Make sure you are subscribed to the channel and have activated the bell now. Why? Because in a few days, I'll be posting an extremely uncomfortable video about a supplement I see so many of my patients taking, convinced it's good for their prostate, but which is actually silently suppressing their testosterone. It's a video that might piss off some pharmaceutical companies, and I don't want you to miss it under any circumstances. Done? Good. Now let's get back to us and that clogged pipe. To understand why erections fail, we need to stop thinking of the penis as a muscle. The penis isn't a bicep you pull up with willpower. We need to think of it as a highly precise hydraulic system. Or better yet, imagine your penis as a race car tire. For the tire to be hard and perform well, two things are needed. A powerful compressor that pushes air inside, in our case, the arteries that carry blood. A perfectly sealed valve that doesn't let air out, the veins that block the flow. Inside the penis, we have the corpora cavernosa. They are like two cylindrical sponges. When you are calm, these sponges are deflated. But as soon as the brain sends an excitement signal, a chemical magic happens. The nitric oxide. Mark this name because we'll talk about it again shortly. It's the life molecule for erection. Nitric oxide causes the walls of the blood vessels to relax and widen. It's like opening the floodgates of a dam. Blood rushes in with force, the sponges swell, and here's the genius trick. As they swell, the sponges crush the veins on the surface against the outer wall of the penis. Result? Blood enters but cannot exit. It's a perfect mechanism, a very delicate balance between inflow, entrance, and outflow, exit. But what happens when this balance is broken? What many of you experience happens. The erection starts but then fades. It becomes soft midway through intercourse. Or it doesn't start at all. Why? Because the inlet pipes are clogged. I want to tell you the story of a patient of mine. Let's call him Marco. Marco came to me a few months ago. He's 55, a distinguished man. He sat down and said, "Doctor, I read online that my veins are blocked. Can't you operate on me and put in a stent like my cousin did to his heart? That way we'll clear the passage and I'll be fine again." I had to look him in the eye and say, "Marco, I wish it were that simple." You see, the arteries of the heart are large and robust. We can enter there with catheters and place a stent, a kind of spring that keeps the jar open. But the arteries in the penis? They're hairs. They're very thin, fragile threads that branch into thousands of microscopic capillaries. There's no technology in the world today that can reach down there and scrape away the fat like limestone. The problem isn't a single cork we can remove. The problem is widespread. It's systemic. It's called vascular erectile dysfunction and is caused by the atherosclerosis. Imagine your arteries not as smooth tubes, but as pipes where, year after year, you've poured quick-setting cement, cholesterol, fat, inflammation. The lumen, the space through which the blood passes, narrows. And here is the frightening fact that should make you reflect. The arteries of the penis are much smaller than those of the heart. Therefore, they become blocked. Erectile dysfunction is what we doctors call sentinel symptom. It's an alarm bell that rings 3 or 5 years before a heart attack or stroke.
Your penis is talking to you. It's telling you,
Hey, our circulatory system is collapsing. Do something before our hearts stop too. So who's pouring this concrete into your arteries? They're the usual suspects, but they operate in ways you might not realize. The smoke. Every single cigarette is a direct attack on the endothelium, the inner lining of the arteries. Smoking destroys the ability to produce the nitric oxide we mentioned earlier. Smoking is like puncturing the tires of your race car before the start. Not only that, it also reduces testosterone. If you smoke and want strong erections, you're fighting a war you've already lost. Diabetes. This is the silent killer of nerves. High blood sugar is like sandpaper, scraping the inside of blood vessels and frying the nerves that control erections. ED is 3 times more common in diabetics. Hypertension. High blood pressure makes the arteries stiff. If the tube is stiff, it won't expand. If it doesn't expand, blood won't flow. End of story. High cholesterol. The bricks that build the wall that stops the blood. The belly, obesity. Belly fat isn't inert. It's an active organ that produces inflammatory hormones and converts your precious testosterone into estrogen, female hormones. But be careful, I don't just want to scare you, because there's good news. While we can't use a plunger, we can do something much more powerful. We can reinvigorate the body's ability to heal itself. And I'll tell you how shortly, but first, there's a secret about drugs that pharmaceutical companies don't emphasize enough. Many men think, okay, doctor, I'll take the blue pill and solve everything. Wrong. Or rather, partially true but dangerous. Drugs like Viagra and Cialis, or their generic names, sildenafil and tadalafil, are fantastic. I prescribe them and they work. But do you know how they work? They don't create an erection out of thin air. They amplify the signal. They prevent nitric oxide from being broken down too quickly. But if your arteries are completely blocked, or your nerves are destroyed by diabetes, no pill will help. It's like turbocharging a car without gas. It won't start. That's why the Phase 1 treatment is not the pharmacy. It's your kitchen and your gym. Scientific studies show that losing weight and engaging in aerobic exercise can reverse mild erectile dysfunction as effectively as medication. And when I say physical activity, I'm not just talking about running. I'm also talking about weight training for testosterone and specific pelvic floor exercises, the famous Kegels, which help retain blood, preventing venous leakage. What about supplements? Here's a point to clarify. Arginine, citrulline, ginseng, can they help? Yes, as a supportive measure. Citrulline, for example, is a precursor to nitric oxide. But be careful. If you have calcified atherosclerotic plaque, citrulline won't dissolve it. Use them, but always under medical supervision and never as a substitute for real therapy. But what happens if lifestyle and pills aren't enough anymore? Here we enter the medicine of the future. And there's a therapy, which I'm about to tell you about, that is changing the rules of the game for many men who thought they were finished. If the pills don't work, you're not broken forever. You just need a higher level of intervention. The stings, intracavernous injections. I know the idea of a needle down there makes you shudder. I see it on my patients' faces. But I assure you, the needle is as thin as a hair, virtually painless. You inject a drug, prostaglandin, that mechanically dilates the blood vessels, bypassing nerves and hormones. It's incredibly effective. I have patients in their 70s and 80s who have active sex lives thanks to it. Shockwaves, LE-ESWT. This is the real regenerative innovation. We use low-intensity sound waves to hit the penile tissue. This controlled microtrauma pushes the body to create new blood vessels, neoangiogenesis. Here, we're not just patching up the symptom, we're trying to repair the tissue. The definitive solution, the penile prosthesis. When all else fails, we have the ace up our sleeve. A prosthesis isn't a failure, it's a rebirth. We implant 2 cylinders inside the penis, connected to a small pump hidden in the scrotum. Want an erection? Press the pump. Done? Deflate it. No one can see it from the outside. The sensation remains the same. The orgasm remains the same. It's a mechanical solution to a plumbing problem, and it has the highest satisfaction rate of all ED treatments. We're almost at the end, and I want to touch on a point that's often overlooked. We've talked about tubes, valves, drugs, and pumps. But an erection isn't just mechanical. It's connection. It's self-esteem. When an erection fails, a man feels isolated. He feels ashamed. He stops looking for a partner for fear of failing again. And this silence kills a couple more than the lack of sex. Coping with erectile dysfunction is a journey. There's no magic wand that will instantly fix everything. But there is a clear, scientific, and proven path to getting your life back. Don't hide. Talk about it. With your partner and with a trusted urologist. If you feel like your relationship is suffering, or if you want to understand how to maintain intimacy, even while going through these medical processes, I've created a specific resource for you. I wrote an ebook titled, Rediscovering Intimacy: Healthy Sexuality After 60. This isn't a boring medical manual. It's a practical guide to overcoming emotional barriers, rediscovering pleasure, and strengthening the bond with your partner, regardless of physical challenges. You'll find the download link in the first comment below or in the description. Check it out. It could be the best investment for your couple this year. Before we leave, I want to know your opinion. Which of the solutions we've discussed scares or intrigues you the most? Injections? Prosthetics? Or do you think lifestyle is the key? Let us know in the comments. If you found the video helpful, please leave a like. It's free and greatly helps the channel spread accurate medical information. Share this video with a friend you know might need it, even anonymously. You could literally save their life. And if you didn't initially, subscribe now. Remember that video about the dangerous supplement I told you about? It's coming soon. I'm Dr. Melissa Russo. Take care of yourself. See you in the next video.